Welcome, everyone. On behalf of Centers for Medicare and Medicaid Services, CMS Division of Tribal Affairs, in collaboration with CMS Medicaid CHIP and Operations Group, I'd like to welcome everyone to the All Tribes webinar today. My name is Michaela Holm, and I work with Kaufman & Associates, and I'll be your moderator. Today's webinar is titled Preparing to Resume Normal Operations, End of PHE Impact on Medicaid and CHIP Flexibilities. Before we begin, I'd like to highlight the main features of your Zoom webinar interface. First, the presentation slides will appear in the main window, while the speakers will appear in the top corner. At the bottom of your screen is a menu bar. Here you'll find the chat, raise hand, Q&A, and closed caption functions. Please use the chat box to report any technical issues you're experiencing, and we will respond to these concerns as they come in. Next to the chat box is your raised hand feature. You're able to use this during the Q&A segment and let us know when you'd like to unmute your mic so you can ask a question. Another way you're able to submit a question is in the Q&A box itself, where you can leave your question at any point during the webinar for the presenters to address during the Q&A segment at the end. Lastly, live captioning is available for today's broadcast. Simply click the CC icon for this feature. Please be aware that today's webinar is being recorded and that the recording will be made available online in the near future on cms.gov. With that said, I would like to welcome everyone to today's webinar. The webinar series is supported by an award by Centers for Medicare and Medicaid Services. The opinions, findings, conclusions, and recommendations expressed in this webinar are those of the presenters and do not necessarily represent the official position or policies of the Department of Health and Human Services or the Centers for Medicare and Medicaid Services. So thank you all for attending today. And at this time, I will turn it over to Beverly Lofton. Thank you.
Thank you so much, Michaela. Welcome, everyone. I'm Beverly Lofton. I'm a Senior Policy Advisor in the Division of Tribal Affairs at CMS. This webinar is in collaboration with the CMS Division of Tribal Affairs and CMS Medicaid CHIP and Operations Group. During this webinar, presenters will discuss returning to routine operations after the PHE as it relates to Medicaid and CHIP disaster relief SPAs and 1135 waivers. Any materials related to this presentation can be downloaded from our spotlight page at the CMS American Indian and Alaska Native Outreach and Education website. So that can be found at go.cms.gov/AIAN. We are pleased to be joined on this webinar by Cindy Gillespie and her colleagues from the CMS Medicaid and CHIP Operations Group. The web link from this, the web link will be added to the chat, just so you'll know. And at this point, I'll turn it over to Cindy, and she will introduce our speakers for today, and they will begin the presentation. Thank you.
Thank you, Beverly. Good afternoon. We're delighted to be here today to talk to you about Medicaid unwinding. I'm with the Medicaid and CHIP Operations Group with the Division of Program Operations. Our two speakers today, Maria Tavakov and Tanis Joyce, are both also with the same division, and they are both focused on unwinding activities in the state. You're really fortunate to have our Medicaid and CHIP Operations Group experts here with you today. They have provided this information to various levels of state leadership, as well as our state calls with state staff to tell the states what they need to do to prepare for unwinding when the public health emergency comes to an end. And they're here today to share with you the activities that the states will be going through and the decisions they will be making as the public health emergency winds to a close, or unwinds as we call it. So I'm going now to turn the presentation over to these two experts in this area from our Medicaid and CHIP Operations Group. And so Maria and Tanis, thank you both for taking time to join us. I'll let you go ahead with the presentation.
Thank you, Cindy, and good afternoon, everyone. So over the past year, we have been working with states to help them prepare to return to routine operations after the end of the PHE. Today, we want to recap a few presentations that we have conducted for our state partners that highlight the key PHE flexibilities and options for states to continue state plan flexibilities beyond the end of the PHE. Next slide, please. On January 30th, the administration announced its intent to end the national emergency and the public health emergency declarations related to the COVID-19 pandemic. Secretary Becerra sent a letter to governors on February 9th, renewing the PHE for an additional 90 days. Based on the current trends regarding COVID-19, HHS is planning for this to be the final renewal and for the PHE to end on May 11th, 2023. Next slide, please. On this slide, we listed various flexibilities and their expiration dates. Medicaid disaster relief state plan amendments will expire at the end of the PHE or an earlier date if it was requested by the state and approved by CMS. CHIP disaster COVID-19 SPAs will expire at the end of the PHE. CHIP Evergreen disaster relief SPAs will expire at the end of the state declared emergency or the end of the PHE, whichever is later. Both of the SPAs may also expire at an earlier date at the state's discretion. Home and community-based services appendix case and attachment case will expire no later than November 11th, 2023, which is 6 months after the end of the PHE. Medicaid and CHIP 1135 waivers expire at the end of the PHE. Section 1115 COVID-19 demonstrations generally expire no later than 60 days after the end of the PHE, unless it's noted differently in the approval documents. Some demonstrations will end before the end of the PHE. The optional COVID-19 group expires at the end of the PHE. There will be no federal financial participation available for any of those state expenditures on services for this group, including coverage of the COVID-19 vaccination, testing, and treatment after the PHE ends. The mandatory COVID-19 vaccination, testing, and treatment without cost sharing, and the increased FMAP and EFMAP for the coverage of COVID-19 vaccines and administration will end on September 30th, 2024. Next slide. Under Section 1135 of the Social Security Act, the Secretary can waive certain requirements related to Medicare, Medicaid, and the Children's Health Insurance Program to ensure that sufficient healthcare items and services are available to meet the needs of enrollees in affected areas. Section 1135 waiver authority can be used if an emergency or disaster is declared by the President and the public health emergency is declared by the Secretary. Many states and territories have received approval to waive certain requirements in Titles 18, 19, and 21 of the Social Security Act through Section 1135 waivers related to COVID-19. As I mentioned earlier, these waivers expire at the end of the PHE, and we have asked states to consider actions needed to return to routine operations. These actions include, as appropriate, providing 10 days advance notice to Medicaid beneficiaries before ending certain 1135 waivers when required by regulation, and also informing providers timely of these changes to minimize disruption. States have additional time to complete some actions related to the expiration of 1135 waivers after the PHE ends. Examples include the completion of initial HCBS level of care determinations, completing provider screening, and finalizing provider enrollment. Next slide, please. Changes made to the Medicaid state plan using a disaster relief SPA will also expire at the end of the PHE unless the SPA included an earlier expiration date. CMS provided states the following options for unwinding disaster relief SPA provisions. The first option is to let it expire. States can allow the provisions to expire at the end of the PHE, and there will not be the need for any action from the state. Second, states can end the approved provisions before the end of the PHE by submitting a rescission SPA. States can also extend the SPA provisions for a period of time after the PHE expires through a streamlined SPA process. Or states can continue the provisions indefinitely. This means that the state will need to submit a regular SPA that does not have a specific end date. Next slide, please. As tribal leaders and healthcare providers, you may want to think about the changes states made during the PHE that were key for your communities, and provide input to the states about the flexibilities that you would like for them to extend if possible. For example, we have heard a number of Indian healthcare providers talk about the importance of telehealth during the PHE. States had the flexibility to cover services provided via telehealth prior to the public health emergency and will continue to have this option going forward. Many states expanded the use of telehealth through a disaster relief spa or through an operational change in an effort to make services more available and safer for both the beneficiaries and the providers during the PHE. Telehealth changes made through a disaster relief spa will automatically sunset at the end of the public health emergency, so states will need to plan accordingly. Although ending telehealth as a modality for delivering a covered service does not require advance notice or fair hearing rights, we recommend states provide clear and timely communication of telehealth policy changes to beneficiaries. We also know that providers need to receive these messages in order to deliver services in a manner that is consistent with the state's PHE policies. CMS has released a telehealth toolkit and supplement. This toolkit explains the telehealth policies and the circumstances under which services provided via telehealth can be reimbursed. Next slide, please. Now I will turn it over to Tanis Joyce, and she's going to walk us through a detailed overview of the state plan options.
Thanks, Maria, and good afternoon, everyone. So as Maria described, states have several options for unwinding disaster relief spas, either before or after the public health emergency ends. So based on the state's needs, the state officials may decide to rescind an existing disaster relief provision before the end of the PHE. So removing a provision from a disaster relief spa or ending a provision earlier than originally approved is considered a reduction and therefore cannot be done using that Medicaid disaster relief spa template. Next slide. So in order to end an approved disaster relief provision, states will need to create a new subsection in section 7.4 of the state plan titled 7.4A. Rescission spas are subject to all federal review requirements, including submission effective dates, public notice, and tribal consultation as applicable. Next slide. After states review approved disaster relief spa provisions, they may also decide that they want to extend a provision temporarily after the end of the public health emergency, as Maria had described. And they can do so either without modification, meaning those provisions states would like to extend exactly as it's written in the approved disaster relief spa, with modifications, meaning a state would make changes to some of the details of that provision, or states may also identify additional new provisions that were not part of an already approved disaster relief spa, but might be needed temporarily to help transition to routine operations. Next slide. So last year, we also introduced the option to create new state plan subsections 7.4B and 7.4C that can be used for these time-limited provisions aiding in the return to routine operations. So I'll emphasize here that all of the SPA options we're presenting on today are subject to the regular SPA submission requirements, including effective date requirements, public notice, and tribal consultation. Section 1135 SPA process flexibilities are not available for these types of SPAs. I also want to highlight that states may decide to just use one SPA submission that includes all of the temporary provisions, either with or without modifications. If these provisions have different effective periods, we're asking the states to include the provisions on separate pages with the proposed expiration date for each of the provision or group of provisions. So secondly, these SPA submissions should not be combined with a template disaster relief SPA. And if that happens, we will separate these two. And if the state intends to have the provision in place for longer than 1 year or right around the 1-year mark, we're going to recommend that they submit these changes in the applicable state plan section. Next slide. So just focusing a little bit more on the requirements, specifically public notice here. There are 3 types of spas that have a public notice requirement. So the timing and the content of each provision are described in the regulations. And it's important that states plan in advance to ensure that public notice is conducted timely, so as to help avoid any possible interruption in current authorities. So first, public notice is required for any Medicaid state plan change that substantially modifies alternative benefit plans, or ABPs, and must be completed prior to SPA submission. Second, cost sharing public notice requirements require that states complete public notice prior to submitting any SPA substantially modifying premium or cost sharing policies. And public notice is also required prior to the SPA's effective date for any significant proposed change to the methods and standards for setting payment rates for services. Let's move on to tribal consultation. Next slide. Now you all know this. As you're all aware, states must ensure applicable tribal consultation requirements are met. In states where 1 or more Indian health programs or urban Indian organizations furnish healthcare services, the state must solicit advice from designees of these entities prior to certain SPA submissions. And soliciting advice is required for any Medicaid SPA change that's likely to have a direct effect, as defined in each state plan, on American Indians, Alaska Natives, Indian health programs, or urban Indian organizations. And tribal consultation, or the solicitation of advice, may be required for both positive and/or negative changes in accordance with each state's approved tribal consultation state plan. So similar to public notice, timing is key here as well, as some states have specific tribal consultation timelines in their state plans that need to be followed. For example, conducting tribal consultation 60 days prior to SPA submission. We encourage you as tribal leaders and advisors to reach out to the states well before the end of the PHE to let the state know what provisions you would like the state to consider extending. And this will help the state plan well in advance so that they can meet all of these requirements, including tribal consultation, public notice, effective date, etc. Next slide. So now we'll move into the submission and review process of temporary SPAs. We're going to start with those SPAs without modifications. So for these types of SPAs, states should establish what we talked about earlier, a new state plan subsection, section 7.4B. And these pages will follow right after the disaster relief SPAs in section 7.4, and then any disaster relief rescissions included in section 7.4A. Next slide. We're asking states to begin this section 7.4B with the following introductory language included on the slide. There's not a template for these, but we are providing the suggested language for the title and kind of how to start it out. So this introductory paragraph should include the approval date and disaster relief SPA number, where the provision or group of provisions were originally approved. And then the state will just, or they should just cut and paste the approved disaster relief SPA language into this section, and they can submit it. Slide. So on this slide, you can see a sample of what the section 7.4B page may look like for these SPAs that would temporarily extend these provisions without any modifications. The page, like I said, it directly follows the disaster relief SPAs in section 7.4A and rescission SPAs. State will include the SPA page title, introductory paragraph, the approval date of the original disaster relief SPA, and then they're going to include the effective date of May 12th, 2023, since we now know when the public health emergency ends. So this is the day after the public health emergency ends, and then they'll include a sunset date. Next slide. So to streamline the review and approval of these SPAs, we will be relying on the policy review conducted as part of the initial approval of the state's disaster relief provision. We anticipate the review of these spas to be handled in an expedited manner. And during the review, we will be confirming that the language is exactly as approved in the disaster relief spa, that the state has included a sunset date for all the provisions, that the state has followed the effective date requirements, the public notice requirements, and tribal consultation. And lastly, where applicable for the ADP alignment, states will also be confirming that the state included an assurance that the extension also applies to ABP. Next slide. Okay, so now we're going to move on to the temporary extension spas with modifications and the spas that are going to be adding new temporary provisions that were not previously included in an already approved disaster relief spa. So for these spas, states will be using section 7.4C. And just a reminder, we talked about these spas must comply with the effective date requirements, public notice, and tribal consultation. One thing to highlight here is for states modifying an approved disaster relief spa provision. So they want to make some changes to what was already approved. The state is going to have to come in with a rescission spa as well, and it can be submitted at the same time. So they'll submit the rescission spa ending that disaster relief spa provision, and then submitting the 7.4C page with the change. Next slide. So focusing first on the modifications to provisions already included in an approved spa, we're asking states to use the introductory language included on the slide. And then, as we said before, states should also cite the disaster relief spa number where the provision was originally approved and that spa's approval date. And then the state will add the modified spa language. Next slide. In section 7.4C, states can also temporarily amend the state plan with additional or new changes, so not already approved. These changes should be directly related to the state's COVID-19 PHE unwinding efforts and should be different than what is currently approved in any of the state's disaster relief spas. So on the spa page, we ask that states use the introductory language identified on the slide. Next slide, please. So here we've included a sample of what the section 7.4 page could look like for these types of spas. For modifications to provisions already included in a spa, we're asking that states use the introductory language that's included on the top portion of the slide. States should, again, cite the disaster relief spa number where the provision was approved, that spa's approval date, and then add the language. And then the bottom half here, there's a sample of language that the state would use when they're adding new changes. The introductory language will include, again, both the effective date and the sunset date, since states may want to implement a change prior to the end of the PHE. You know, as we're getting closer to it, I don't know how many states will come in, but we are starting to see quite a few states coming in, either rescinding or making some modifications. So we'll review these spas following all the standard processes, including spa review timelines and ensuring the effective date is accurate and that the public notice and tribal consultation is conducted. Next slide. So if the state intends to make a disaster relief spa provision or provisions permanent in the state plan, then they just submit a regular spa. And we've had states do this. So the spa can either have a requested effective date of May 12, 2023, the day after the end of the PHE, or the state could request an earlier effective date if needed. And again, we will be reviewing the spa following all the standard processes, including spa review timelines and ensuring that public notice and tribal consultation is conducted properly. Next slide. I'm going to turn it back over to Maria, who's going to walk through some additional summary slides for us.
Thank you, Tana. So we put together this slide and we wanted to give you a visual on what these different options that Tana has just walked us through will look like on a SPA. I know many of you have likely seen them already because many have been submitted to us and probably already went through tribal consultation with you. So we wanted to just give you an idea of what it is that you're going to be getting from states if you haven't received them yet, and then you'll likely get more. We're seeing states still submitting them. So we just wanted to make sure you understand what you're looking at once you get those tribal consultation documents. So in this table, we have 6 scenarios. Then we have the 3 different SPA options that are available to states, and then the operational actions that states will need to complete for some of these types of changes that they want to make. So on the first scenario is where the state elects to end and approve disaster relief, to let the disaster relief SPA provisions expire at the end of the PHE. So for that, the states don't have to submit anything to us. The disaster relief SPAs have an expiration date, which is the end of the PHE. So they will just sunset on May 11th. And the states will not have to submit anything to us in order to do that. However, they do need to comply with any beneficiary advance notice requirements, and we're advising states to inform providers as appropriate. On scenario 2, states elect to end the approved disaster relief SPA provisions before the end of the PHE. So we've had states submit rescission SPAs, and that will be in section 7.4.a. This allows the states to end a provision before the end of the PHE. However, states are not able to use any 1135 flexibilities for this type of SPAs, so they will have to comply with all the SPA submission requirements. That includes tribal consultation, public notice, and the effective date requirements. In addition to that, the states will need to comply with any advance notice to beneficiaries that are applicable to the provision, and also we're advising states to inform providers as appropriate. The third scenario is where the state elects to temporarily extend a disaster relief SPA provision without modifications that are effective the day after the end of the PHE. For this, the state will need to submit the provision in section 7.4.b, and they will need to comply with all the SPA submission requirements. In scenario 4, states are electing to temporarily extend the disaster relief SPA provision with modifications effective the day after the end of the PHE. For this, they will use section 7.4.c. They will need to comply with all the SPA submission requirements, and they also need to comply with any advance notice to beneficiaries and inform providers. Scenario 4 is where a state elects to modify an existing DR SPA provision before the end of the PHE and continue it post-PHE. So the first thing that the state will need to do, and this could all be done in one submission, but they will need to include a section 7.4.8 rescission page where they will be ending what is approved in the disaster relief SPA, and they will submit a section 7.4.c page where they will be modifying the language that was approved in the DR SPA and that they plan to continue for up to 12 months after the end of the PHE. Again, this will require the state to comply with all the SPA submission requirements and advance notice to beneficiaries and informing providers that's applicable. Finally, this is an option where the state would like to implement something that is not currently approved in a DR SPA, but they would like to have it in place for a temporary period of time. It could be either before the end of the PHE or after, or the day after the end of the PHE. And for that, they will need to submit a section 7.4.c page and will need to comply with all the SPA submission requirements. Next slide, please. On this slide, we also wanted to provide you with another visual that summarizes all the timelines and actions that states are required to complete for the different PHE related flexibilities. We advise states to assess their approved flexibilities, to prepare to take actions needed for those flexibilities ending with the PHE, and to plan for the submissions of SPAs needed after the end of the PHE in order to avoid any authority gaps. And finally, after the end of the PHE, as you can see here, we're asking states to complete any additional actions needed, such as finalizing provider enrollment. Next slide. On this slide, we put together a few resources that we think will be helpful for you. So as I mentioned at the beginning, we have conducted multiple presentations for our state partners over the past almost 2 years now, and we wanted to compile those together for you here in the resource slide. The first 5 links here are for all stakeholder presentations that are related to the topics that we covered today. The latest one was on February 14 of this year. So you will find the most up-to-date information in there. This presentation was conducted after we knew that the PHE will be ending in May 11th. So that's where we are able to provide a little bit more details about the different timelines, specific dates. And then the next resource that we included for you here is the state health officials letter that was released in December of 2020. This letter includes a lot of the information, again, that we share with you today, and it's a great resource if you want to understand what actions are needed in order to add some of the flexibilities, including the disaster relief spot provisions and the 1135 waivers. And the 2 resources that we included are related to the Consolidated Appropriations Act of 2023. These are resources that we released recently as a result of the CAA passing. So we think this will also be a good resource for you if you're needing more information regarding what it will be required of states based on the legislation. Next slide, please. Okay.
All right, thank you, everyone. So at this time, we were going to open it up for questions. So if anyone has a question, you can either place it in the Q&A box at the bottom of your screen, or you can use the raised hand function and we can unmute your line. Again, if there are any questions, you can please put those in the Q&A box, or you can raise your hand. Oh, I see Cassandra, you have raised your hand. So Tom, if you could help assist unmuting Cassandra's line.
Hi, everybody. This is Cassie Holmes. I'm at the Indian Health Board in Minneapolis. I do have a question. I'm really new to this. So for American Indians or Alaska Natives that are enrolled in a federally recognized tribe, and they can apply at any time, right? Like once a month, is that for just like, let's say like Minnesota Care, or is it just for the QHPs? Like, how does that work?
So to answer your question, I'm Cindy Gillespie again. So I think you're referring to the provision in the marketplace that allows American Indians a special enrollment period. Tribal members get a special enrollment period to enroll in the marketplace at any time. Medicaid does not have open enrollment periods like private insurance or the marketplace. So a person can apply for Medicaid at any time throughout the year. And generally it will go to the beginning of the month they apply, or maybe even prior if they have bills that they incurred prior to applying. So Medicaid has no open enrollment periods, and people can apply at any time.
Do you know if that's the same? Sorry, Cassie Holmes again. Do you know if that's the same? I'm still like learning for like MA. I mean, is that the same?
Medicaid, medical assistance is generally referring to Medicaid, yes.
Okay, so, okay, thank you.
Thank you. And again, if anyone else has any questions, you can place that in the Q&A box at the bottom of your screen, or you can use your raise hand function and we'll get your line unmuted. We have one hand raised. If Tom, if you could go ahead and unmute their line. Okay, your line should now be unmuted.
Okay, great. Hi, this is Dana Miller from Oklahoma. I just have a quick question. I saw that the cms.gov /AIAN was posted in the chat. Is that where we find the chart that has the 6 scenarios with the 3 spa options?
I could answer that, Cindy. So you can find a chart on Medicaid.gov on the slides that we presented on the February 15 OSA call. And I believe this slide will also be shared, but I could put the other link on the chat so you have it, and then you'll be able to access the information. It's a slightly different version of the presentation, but it has the information that we presented today.
Okay, thank you.
And this is Beverly. Yes, the slides will be shared on the Division of Tribal Affairs website that was listed here. And again, that's at go.cms.gov/AIAN.
Okay, great. Thank you.
If there are any other questions, please place them in the Q&A box or use the raise hand function and we can unmute your line. Okay, at this time, Beverly, I'm not seeing any other questions come through.
Okay, thank you. Thank you so much. So I would like to thank the presenters, first of all, for your wonderful presentation, and also thank the participants for joining for today's webinar. Again, those slides and any materials from today's webinar can be found on our spotlight page of the American Indian and Alaska Native Outreach and Education website, and that's at go.cms.gov/AIAN, and that's under all tribes calls. And as always, if you want to submit any inquiries to the Division of Tribal Affairs mailbox, this is that for the mailbox, that will be found at tribalaffairs@cms.hhs.gov. So with that said, everyone have a great afternoon. Thank you.
Beverly, we had a question come in.
Another question came in? Sure.
Yes. William Taylor is asking, so is the unwinding deadline different for the tribal employees?
I didn't hear the last of that, I'm sorry.
Oh, my apologies. Is the unwinding deadline different for the tribal enrollees?
No, the public health emergency will end at the same time for everyone in the state. Special provisions that they got approved during the public health emergency will also end then. So they would have to take the actions that Tanis and Maria described to continue those, or to engage in other mitigation or things to help with the public health emergency ending. It will be the same, for tribal members as for, non-tribal members in terms of experience with the program as a provider and or a beneficiary. And maybe I didn't quite understand the question. If I missed the mark, let me know.
And I think that's it. Do we have any other questions?
There are no other questions that have come through.
Okay, thank you. And also there's a reminder that in the chat, Maria put the link to the slides that she mentioned earlier as well from today's webinar. Okay, thank you so much. We'll have a good day.